I had a chance to speak to Charles Michel. He's the EU Council President, and I put it to him that one of the reasons we're involved in this so-called second wave is because Europe relaxed the rules and regulations way too early over the summer and early autumn.
In hindsight, we cannot say that everything was done in a perfect way. This is absolutely certain. But at the same time, remember the atmosphere in Europe in June, in July, at a time when, in many countries, the situation was stabilized in terms of the amount of infections. And there was great expectation, especially from economic actors, to be able to restart social and economic life. This is the whole difficulty that we are faced with. Vaccines are expected to be available from the end of this year and the beginning of next year, but they won't be a magic wand. Vaccines will need to be deployed effectively across Europe, trying to identify priority populations, especially the most vulnerable, like the elderly or people with chronic diseases.
So potentially, Toke, some pretty good news, hopeful news when it comes to that vaccine potentially being available, certainly from the start of next year, and that these tests could really help. The problem is that we've been here many times before. We've heard about the EU trying to coordinate efforts. We heard it in May, we heard it in June, we heard it in July. We're now hearing it again. The question is, can they turn all these great ideas about coordination into actual practical reality? EU leaders meeting via video conference tomorrow to discuss all of this.